Okay, let's get started. Good morning. Welcome to
Morning.
louder, please don't. Welcome to From Chaos to Clarity, Organizing Your Medical Journey. I have to note that this session a bit later in its planning was nicknamed From Chaos to a little bit more clarity, because we can't really sugarcoat the complexity of navigating some of the things we'll talk about today. But I think that was you, Stacy, that made that comment. Very spot on. She keeps it real. My name is Bethany Bonner. I'm the Support and Education Associate with UMDF. And this session was made possible by a dedicated team of supporting ambassadors, Paul Laurie, Jenny Hobbs, Stacy Taylor, and Joy Crumdick and Jeff McDonald, who are not here. Paul, Jenny, and Stacy will be sharing today their approaches when it comes to staying on top of care and information as patients and or caregivers. We are also delighted to be joined by the Dr. Russell Saneto, attending physician in neurology at Seattle Children's, to hear a physician's perspective on this topic. I guess I should change slides, huh? There you go. A little background about how this came to be. So in support and education, Margaret and I take support calls, and we manage the support meeting. So we started to notice some recurring questions and concerns, and some of the more common being, I have a really big appointment coming up. I'm establishing with a new doctor, or I'm changing doctors. I have no idea what should I be asking my doctor at my appointments. With stacks of history and paperwork, what does my doctor want to see me bring to appointments when I'm establishing with them or having a follow-up? And concerns such as, I am totally inundated with information and overwhelmed with phone calls, paperwork, appointments, to-dos, and the list goes on and on for people. So we found a big need here to have a discussion surrounding this. So our goal today is to have a multi-perspective discussion about practical approaches to managing and organizing your patient journey, as well as preparing for appointments so that you can optimize the limited time you have with your provider, and hopefully, if even just a tiny bit, reduce some mental load. So I'm a kind of a visual person, and I have a picture of yarn unwinding up there. And I like to think of overwhelm as a bundle of knotted yarn. So how do we unravel that and knit it into something that's comfortable for you and something that's sustainable and durable that you can use for many years through structure and action items we will talk about today. Okay. A few considerations before we begin. Everybody sharing has their own unique circumstances and preferences that influence their approaches. So you may hear things that you love and things that you're like, I will never do that. So that's completely fine. Take the bits and pieces that you hear that speak to you. And also, please take care of yourself. It's been a long couple days of chatting and information and more chatting. So please, if you need to close your eyes and listen or stretch out, get a snack or something, please feel free to do so. So we're going to get started by hearing first from our ambassador panel, and then we will chat with Dr. Saneto for a bit. And then we would really like to hear from you, if you're comfortable sharing today, about what's been helpful to you. The more perspectives we are exposed to, the better equipped our team can be to create meaningful resources on this topic for patient families for years to come. So thank you so much in advance for your participation. If you're not comfortable sharing today, we can also connect outside of conference as well on a one-on-one basis. So my email is at the bottom of your handout, or I'll stay behind after the session so we can chat. So supporting ambassadors, what are 2 to 3 things that have been helpful in your patient journey as far as organizing and preparing? And I'm going to start with Paul.
Thanks, Bethany. Hi, I'm Paul Laurie. I'm live with my wife, Jerry, who's here, I think, and in Northern California. And I'm quickly just going to say that I think the perspective that I bring is that 6.5 years ago, I was affected with Leber hereditary optic neuropathy, or LHON. and I was 56 years of age. So I kind of bring this perspective, dual perspective, maybe of, a person who was impacted by a primary mitochondrial disorder at a later age and vision loss. So with that regard, LHON is sudden onset and rapid progression of vision loss, and that can create chaos, obviously, for anyone, much like any other primary mitochondrial disorder would do for an individual or a family. So uh, I remember like friends asking me, after I became affected, what are you doing, with yourself? And I remember I would always say, I'm going to a lot of doctor's appointments. And with that, obviously, came just the chaos of managing all of the appointments, the records. And one of the things that my wife and I sort of worked out was this dual file approach of the medical records. And I know some of this is going to be common sense and obvious and probably carried out by all of you, but it might spark something at the end for you to discuss with us or with Dr. Saneto. So what I'm saying here is that I think it's really good to sort of segregate the medical records and the medical administration. And what do I mean by the medical administration? I think it's really important. And whether you do this digitally or in hard copy or hybrid of both, like we do, whatever works best. But the medical administration part now, again, my situation, I was employed. I had to take a medical leave of absence. Short-term disability insurance kicked in, through the state of California where we live. I needed vocational rehabilitation benefits and services from the state of California. All of that sort of intersected with the medical records because everybody wanted medical records or proof or but so that needed to be sort of segregated over in medical administration. I think some other reasons to have this dual file system is that, and some people don't necessarily think about this, is like there could be sort of tax reasons, to sort of track things, and you don't want that sort of cluttered in with the medical records. That could be something that could be more on the medical administration side. Another thing that happened with me is that when I got to a neuro-ophthalmologist at Stanford University, and I was very fortunate that that neuro-ophthalmologist was a principal investigator for an active clinical trial. That sort of added another dimension to my situation, both medically and administratively. And so if you find yourselves, in that kind of a situation, a third file or a separate file for that situation might also benefit you. I think the other thing that has been really beneficial for my situation is that much like a lot of you or your family members, the whole medication, supplements, vitamins, whatever, nutraceuticals, whatever, can get very complex, and it did for me, and it. Keeping that updated and again segregated, like and tabbed or whatever, with maybe with your also with your genetic testing reports, the things you use most frequently is really, really critical, and having that available, especially that medication list, and updated every time you go to any type of medical appointment, whether you're confident that they're probably already have it intact or not, is critical too, especially if you're seeing a new provider and you've got to fill out a form or something like that, or a family member's filling out a form on your behalf, and you get this little space for medication. Writing the word "C" attached and then just handing them over a copy of that is a great way to sort of get away from the chaos of that. Something else before I pass it on that I think is really important for me to make, and a point of, and I think has helped. So my situation is complicated a little bit too, as an adult patient, because I get care, through this Stanford, healthcare system on the adult side. But I am actually a patient at Stanford Children's Hospital biogenetics department, where I see a fantastic team of mitochondrial specialists there. Part of that is, due to the unique genetic mutation that I have for LHON. And so I see them yearly. And before the appointment, I get this sort of questionnaire thing from them, and I fill it out in detail every time I go to the appointment, prior to the appointment. And I don't think there's been an occasion where Dr. Enns or somebody from his staff, one of the genetic counselors, has said, "Thank you so much for completing that." So please, if you go to a clinic or a specialist that does that, I know how burdensome it can be, or how busy your lives are, and especially with caregiving or just managing a chronic condition. But it just makes you, I think, a better patient, and sort of lessens some of the chaos when you get to that particular appointment. And I'm going to pause here, and I think I'll hand it over
Sure.
back to Bethany, or over to Jenny.
Thank you, Paul.
Sure.
All right, Jenny.
Sorry.
Is it morning, afternoon? I don't even know. This whole weekend has run together. So hi, I'm Jenny Hobbs. I live in Winston-Salem, North Carolina, and I have 3 kids that have mitochondrial disease, and I have it as well. So it has been interesting doing this panel and seeing how they're all different. I would say I'm not with the times, because I'm very much a visual person. So I don't like doing things electronically, because there's no way to get the visualization. It's actually brought, and you're welcome to come look at this afterwards, but this is my planner / notebook / like anything, my to-do list, like everything is in here. And also very important to write in pencil, because as we all know, things change every day, and you make plans and they don't work out. And so you need to reschedule. And so if I had to do that with a calendar that was in pen, it would be a hot mess. So I always use pencil. So I like the big picture of the whole month. So I need a nice big planner with big spaces, because with 4 of us with a lot of appointments, those nice little bitty planners are way too small. So I've got to have space. But also what I like about this particular planner, and there's others that do this as well, but it has the week at a glance. It has 3 different categories. And so for me, not only is it my to-do list, but like here, this was a doctor's appointment. So I'll write on it ahead of time. Like when I know there's an appointment, if something comes up in my head that, oh, I need to make sure that I mention this to the neurologist, then I'll go right on that date in the future and start a to-do list or like a list of things that I want to make sure we discuss. And so that way it's already ready to go when I get to that particular week and day. And so then I know I'm not going to lose it, because if I scribbled it on a sheet of paper or something that I might not remember to carry with me, like I remember to carry this. So everything is right there all the time. Let me see, what was the other thing I was going to say? Oh, so I actually helped somebody design a different planner. She was also a mom with multiple children. And so I cannot take credit for this idea, but together we kind of came up with, it was a planner that had like a separate page for medical appointments. And I have just used this one now in the same way, but it's, your list of things of what you want to ask at the appointment. But then at the end of the appointment, it had a section for what do I need to do after this appointment? Is it, calling and scheduling therapy? Is it making sure that we go get an x-ray? Like whatever it is, then I write my to-do list, and then whatever the doctor has said that they're going to do, write that as well, so that if, oh, I never got a call about that PT referral, it will remind me that that needs to happen. Or, oh, I forgot I said I was supposed to go get an x-ray the next day and I forgot to do it. So it's a way for, I guess, sort of accountability, although the doctor's not seeing that my to-do list for them, but it just helps me keep track of what happened at the appointment too, and not just what I came into the appointment wanting to ask. So anyway, that's sort of my system.
Thank you, Jenny. Stacy.
Do you want this one?
Good morning, everyone. I think, as Jenny said, it's been kind of a blur. So I just want to preface my little section by saying, and I think we've all sort of said this in a different way, there's no one right way to organize yourself. We can tell you what we've done, but you really have to develop a system that works for yourself, for your family, for your providers, whoever it is who's going to need the information. And that system can evolve over time. So when my kids were first diagnosed, they're 16 and 18 right now. I did have the binder system. You know, I had like one binder for Marshall, one binder for Sam. We had dividers for each specialist that we went to see. But then as my role in our home changed and I was working full time, so I'm sitting in front of a computer for 8, sometimes 10, 12 hours a day. And then also as the electronic medical record system became more and more prevalent with our providers, I kind of changed how I organized our records. And also I'm really bad at filing. So like I would print stuff out to put in the binder, and then I would have a stack of papers on the dining room table to put in the binder. And then they never went in the binder. So I'm just not good at keeping up with stuff like that. So then the stack of papers would move from the dining room table to the dining room floor, and then from the dining room floor to the box in the basement, and then they just never really got filed. So this is my organizer. I do almost everything digitally. If I think of something that I'm like, oh, I need to remember to do this, then sometimes I will send an email to myself. But I use the Google Drive and Google Calendar. So Marshall has a folder in the Google Drive, and then each specialist has a subfolder within his folder. And then there's also a folder for education. And then within the education folder, there's a subfolder for each school year where like IEP goes, different school documents. Likewise for Sam. And actually, like I have 4 children. So likewise for my other 2 children, because they do have medical appointments and school needs as well. And then also for my husband. And sometimes I even take care of myself. So I have my own folder as well. Everything goes on the calendar. My husband and I have a shared Google Calendar. I have access to my children's Google Calendars. So if I'm scheduling an appointment for them, my older children, Marshall and Sam, don't have their own Google Calendar. But if I'm scheduling an appointment for them, I can look and see like what is their class schedule. I happen to use in my work, we use the Google Office suite. So I have shared my personal Google Calendar to my work Google Calendar. So I can look at both at the same time. So if I'm scheduling an appointment, I can say like, oh, well, I have a meeting that day that I can't miss, or I have a break in meetings that day. So this is a good day to schedule whatever. So I make liberal use of electronic calendars. There's an app called Todoist, there's lots of like organizing tool apps out there. Most of them have some sort of a free platform, and then you can pay extra for extra add-ons. So I do use the Todoist app. I used it as a free tool at first. Now I do actually pay for it because with the paid subscription, you can actually do things like set reminders. So I can say, you know, like, well, we saw ortho in January. We don't need to see ortho again for 2 years. Well, I'm not going to remember that 2 years from now. So I can set a reminder with Todoist and that'll pop up. I get weirdly excited about organizational stuff. So I have a list of all of Marshall and Sam's current providers. And then I literally call it current docs, Marshall and Sam, current docs everyone else. And it's a spreadsheet, and it's, you know, the name, where they are, the phone number to use to schedule an appointment, the emergency phone number, and then when the last visit was and when the next visit is supposed to be. It's just a really quick reference. Marshall recently turned 18, and we applied for Social Security income for him. And it was an invaluable tool, because one of the questions that they ask for with a Social Security application is, what doctors are you seeing? When was your first visit? When was your most recent visit? And when is your next visit? And I could go and look at that list of current docs and say, like, okay, we went to CHOP. Our most recent visit was in December of 2024. Our next visit is in July of 2025. The other thing that I was able to do by using Google Calendars is I could search in Google Calendars and just search for CHOP, for the keyword, and say, you know, so our first visit at CHOP was in July of 2020. And then with the current doc list I had. So there was a couple of different points of reference. So I didn't have to scramble through a lot of piles of paperwork. I could just do those searches. And then the other thing that I have is I have whiteboards. I have a lot of whiteboards around my house. We have a big whiteboard calendar, and Marshall tells me it's a month calendar. So we do kind of have that at a glance view. So at the end of every month, the beginning of the next month, Marshall tells me, Ma, we got to do calendar. And I transfer all of the information to the whiteboard. So that way, at a glance, we can say, like, oh, we have, 4 appointments this week. Why did I do that to myself? And let me, yes. And let me figure out, coverage for whoever's going to be at home or whatever. And then we also use whiteboards for medication management. So if it's something that's maybe just like 2 weeks, I do, Monday, Tuesday, Wednesday, Thursday, Friday with a checkbox. And each time they get the medicine, it gets checked off. I know if I did it, I check it off. I know if my husband did it, because maybe I had to leave early for a morning meeting and he did the morning medication. I know if he did it, because he's supposed to check it off. He doesn't always check it. But then we also we track how much fluid intake Sam has to make sure that he's staying hydrated. So every time he drinks something, we just write a little note on the whiteboard, 9 ounces, 6 ounces, 17 ounces, whatever it is. And then we just add it up at the end of the day. And then we know how much fluid he's had. And then at the end of the day, it gets erased. And then we start again the next day. So we do also kind of make liberal use of whiteboards. And then the last thing is that I keep, I just have a notes app on my phone, and you can do kind of different, basically it's like a different document for each one. And so if I know we have an appointment at CHOP coming up on July 1, I just start, as I think of things, I just put it on the notes document. And then when we go to the appointment, I can pull that up. It's really easy. And I can take notes right on there. So as the doctor is saying, oh yeah, maybe we could think about adding NAC. I can write, what the heck is NAC? What, look up how to get that. So that also is really easy. And I think there's going to be more time to talk. I know I'm talking a lot. I think there's going to be more time to talk. But the other thing that I try to do is think about before, during, and after appointments. So before, keep that running list of questions and concerns, no matter how far in advance, keep that running list. During the appointments, I always try to tell new parents, whether it's somebody with a chronic illness or not, do not leave that appointment if you don't understand something. If something is unclear to you, don't walk out the door until it is clear to you. And I think Jenny mentioned this, document your next steps, the appointment you may have to schedule and follow up, the information that you have to send and follow up, document the provider's next steps. What did they say that they were going to do to follow up? And then after the appointment, when you get those after visit notes in your electronic medical record, read them to make sure that you agree with what was documented in the visit notes, and that it accurately portrays what any follow-up is that you or the provider has to do. And Dr. Saneto, I think, can speak more to that. And then actually do the follow-up on the items that you're supposed to follow up on. And then set a reminder on your calendar or wherever you set your reminders for when to schedule the next appointment. That's often one of my biggest challenges because some providers are every 6 months, some are annual, some are every 2 years. So just trying to kind of remember, like, well, when do I have to schedule that next appointment? What are we supposed to do next? That's really challenging.
Thank you, Stacy. So Joy is one of our ambassadors from Washington, and she shared that she uses a binder organization system, the first binder serving as a primary info hub with all the at-a-glance essentials. So each binder thereafter is designated to a specialty. So the first binder, I like to look at it as the table of contents in a book, and then each binder thereafter as like a chapter in the book. But in that first binder, she shared that she has a list of every single provider she sees, where they're at, their contact information, a list of medications, emergency contacts, any My Chart or medical information portal information and logins, pharmacy information, insurance information, and then it's a bit more detailed in each binder thereafter. So if she has an endocrinology binder, she might have any diagnoses related to that specialty listed under there, medications that are prescribed by that physician. And then she organizes her medical appointment summaries in chronological order thereafter. So it kind of creates this timeline from when you first start seeing this provider and onward. We'll wait till that's done. And then Jeff is one of our supporting ambassadors from Indianapolis, and he shared he also uses a binder organization system, but he spoke a bit more on preparing for appointments and also processing appointments, which I thought was interesting as well. So he recommended trying to anticipate the course of conversation when meeting with your provider, which might be more difficult for maybe the newly diagnosed, just because you might not even know what is going to be discussed in an initial appointment. I'm sure a lot's covered. So, but he said, try to anticipate, if we're going to take one route, what questions might I have about that? And then kind of go into sub questions. And then he also recommended creating your own documentation after an appointment, which I thought was really interesting because he says in his own words, it makes it not only more digestible, but it helps process the contents of that appointment and sort of solidify, what was discussed and what's expected of him going forward. And he also recommended using 5 W's when you create your own documentation: the who, the what, the when, the where, and the why. So it also, he mentioned it's a good opportunity to check in with yourself as well about how you're feeling. And in that process of writing things out, sometimes you unearth questions that you want to put aside and save for your next appointment so you don't forget. So there are a couple template tools online. We were going to create our own, but we were like, we don't really have to reinvent the wheel because there's some really great stuff out there that you can download for free. And this is an example that Jenny provided. If you're more of a straightforward, clean, clear cut sort of example, that this is the one for you. And it comes in a Google sheet as well as it can be printed as well. But the next one, these are just at a glance screen grabs here, but this is a very comprehensive document from Hartford Healthcare. And it has checklists and bubbles throughout it where it asks you questions to check in about how you're feeling or what concerns that you might have after an appointment or during one. Yeah, kind of the same thing, just a bit more detailed. So if that's your jam, this is the one for you. All right. So Dr. Saneto, how can patients make the most out of their time with you when they come to see you?
A Diet Coke and chocolate. I'm only kidding. So I work at Seattle Children's, and we have a catchment area of 8 million because I wrote the fellowship, and we have under 16, we have about 85,000 kids. We saw the need to train an adult specialist, so I trained him, and he's now seeing the adult side of patients. But I feel like a father sometimes, and I don't like to let people go to the adult world because maybe I have a huge ego, but I think I do it better than the adult guy does, because the adult guy is mostly interested in adult things, and I'm more interested in patients' well-being. And since I started taking care of them when they were little, I feel this kind of bond, and yeah, I hate to give it up. Oh, I hate to give it up. And so I tend to sneak adults into my clinic, especially if the adult has a child with a mitochondrial disease. That's the easiest thing for me to do. But we live in the era of EPIC, the electronic medical record that most institutions have. So for instance, if I was seeing the person on my right and I knew that you had seen somebody at CHOP, I can actually go into EPIC and look at the note from CHOP and get a feel for what I need to do and what kind of answers you have and what kind of questions you may have. And another thing I think that as physicians, most of us are learning to do is not to believe every note in EPIC. Because what happens is something called cut and paste. You get an opinion from a gastroenterologist that you have constipation, which is not new to you, and that gets cut and paste in every note going forward if someone's trying to figure out what they need to address when they see you. So that can be a major issue too. So that's on my end. Fortunately, I have a clinical coordinator, and we do a lot trying to reach out prior to appointments to make sure that we're getting the sense of what's really needed. Because sometimes I see a patient that has a mitochondrial disease and epilepsy, and they see a neurologist in Walla Walla who's trying to control their seizures, but that person doesn't know a lot about mitochondrial disease. And so I have to be careful to walk on shells that I don't offend that neurologist, but let them know that maybe valproic acid may not be the best thing for this little child who has pole gamma disease. And the good thing about the medical record is I can do that. But before our first visit, we do what Greg Enns does at Stanford, is we send out this survey, not really a survey, but what's your diagnosis? How do you know about your diagnosis? What do you know about your diagnosis? What concerns you the most? What sort of things are you doing to take care of yourself? If I'm seeing their child and their child's 17, have you figured out what you're going to do for power of attorney, or it's going to be guardianship, or how you're going to transfer medical records? What happens when your kiddo goes off to college and they don't sign a release of information and something happens? Well, that healthcare center at the college doesn't have to tell you. But if you have a release of information that you send along with Billy or Sally, takes along with you and you drop it off, then they can share that healthcare information. So we ask questions about that. I'm the eternal optimist. We're going to find a cure. And so we're going to need to do that. My chart on EPIC can be a curse or a blessing. We often, unfortunate, because my care coordinator, Coral, kind of filters it for me. And then I get an email, you really need to answer this before they come. And so I'll go and look at the my chart note and see what the family's really concerned about. And I try to get to it. So in my mind, I have a file system of pre-diagnosis and then after diagnosis, and then what I need to do for each patient. And it can be very difficult when you get numbers. And what I have to keep from doing is there are no cookie cutter mitochondrial patients. just like there are no cookie cutter epilepsy patients. Everybody's their own person, their own dilemma. And the cares and concerns are always different for each family because you live in your own world and I don't live in it, but I have to learn about it. And then I have to try to preempt that. And since I do a lot of clinical trials, I need to know exactly what you got. Because if I'm going to do a clinical trial, then I think it's a good clinical trial. For instance, probably a lot of you have heard about the EPI 743 trial. Well, we were doing that. But I had to know everybody that had a diagnosis, everyone that didn't have a diagnosis, and everyone that didn't have a diagnosis. It was my job to make them have a diagnosis so I could get him in the trial because we all knew that it worked. And now that it's companies pulling away the drug, we're all scrambling, trying to figure out what we can do. And also, I know you have Lon, but genetic therapy at Newcastle, that's a game changer. Well, how can I get my patient into that trial? And luckily, I knew the people at Newcastle, and now they're with Chinnery, and it's my job as a provider to push to get them in the trial. And if there's a trial for another disease, I need to push for that too. And so it makes I wear a lot of different hats, and you have to be kind with people like me because we get distracted and we have our own jobs to do and other things. So it's really great to be organized to come. And we try to reach out to try to figure out what you need at that visit because I don't have a lot of open visits. And so I want to make that time as fruitful. And a lot of people travel to Seattle to see me. I have a patient that needs to hop 2 mail airplanes to get to Anchorage so they can fly down to Seattle. And that's a full day. And I don't want to waste their full day. And then, we have a concierge service that will pick them up at the airport and other things if they really need it, which is really helpful. But I need to know that in advance.
Right. Yeah.
And so we try to reach out, but sometimes things get lost.
Yeah. Dr. Saneto, is there anything that you typically want people to bring with them when they see you?
Well, yeah, we like to know what medications they're taking. We like to know how, in a sense, how they get their medications. There are a lot of specialty pharmacies out there, and we use a lot of them. But different insurances have different specialty pharmacies that they use. And if I send your specialty drug, let's say I've got you on Epidiolex because you got a certain seizure type and I think it's really going to work for you. Well, that's a separate specialty pharmacy, but it differs from insurance per insurance. So we need to know that. Otherwise, it's going to be this delay, and I don't want that to be delayed. So if you have that information, that can be extraordinarily helpful. If you have a compounding pharmacy, God bless them all because they're so rare. But I need to know that because I need to figure out what I need to order in order for that compounding pharmacy to know what I'm trying to talk about. So little things like that. If you're going to take time off from work, FMLA, please let us know and I can allow my social worker to get involved early and we can get that for you because you miss work and you lose your job. That's no good for your family. And so it's best to have all that stuff in play ahead of time in the guardianship stuff. And it goes both ways. There are some older adults, and the older I get, the age keeps moving upward. But your kids are going to have to take care of you one day. So how are we going to manage that? And you can't expect the government to do a whole lot. I mean, just look at the state of affairs right now. It ebbs and wanes, and the pendulum swings, and you just got to be aware and prepare. And so, family planning is an issue that we start talking about early. And I don't like the word palliative care, but that's just because in my residency that meant one thing and now it means something else. But sometimes that can be really good, and maybe getting that service involved early may be very helpful in this journey. And also, we try to connect families together because you learn from you and you learn from him, and we all learn together. It takes a village to conquer this disease. But I think it was said someplace that the world has hardly ever seen what a small group of passionate people can do to change the world. Well, we're that group, and it's our job to change the way disease is taken care of, especially our disease. And we need your help. So be gentle with us. We're fragile. Most physicians have huge egos, and you don't want to knock on, you know,
Yeah.
you don't want to step on Superman's cape.
Well, and don't
So-
forget the Diet Coke and the chocolate.
Yeah, that's
That's
true.
essential.
And the help, the nurses, the MAs, the care coordinators, the social service people, they're all involved, and they also need to be, I don't know, work with kindness, because they get a lot of the back end stuff too. And it's a hard job,
Yeah.
but we need to work together. And so we need to hear what concerns you.
Mm.
And I think that's what everybody was talking about here, because Molly's concern is not going to be the same as Jack's concern. And, you have a kid with a terrible disorder and there's a possible treatment out there. I know what I'd be doing. I'd be knocking on everybody's door in the world that could take care of my kid. And so, we need to help you do that if there's a way.
When would you recommend a patient consider a second opinion or changing providers?
Well, we're flawed. I have my biases because of my training and what I've done. I miss things. And I think a second opinion can be good and can be very beneficial. But believe it or not, there's only a small community of us taking care of you. And when Amy has a question, she emails me. And if I have a really strange question, I can email her. Or I can email Patrick Chinnery in Cambridge and go, Patrick, remember when we talked about a heart problem? Do you have, And so a lot of second opinions go that way, but going to see somebody is often a good exercise because it allows you to coalesce your thoughts and what you've gone through and then present it new to somebody who will have a fresh mind. The more minds you can be thinking about your disorder, somebody may have an aha moment and go,
Yeah.
oh, I know what that is, or I know how to alter that.
I suppose it's a matter too sometimes of just finding a physician that is willing to network with colleagues in that capacity, which can be a challenge.
Yeah. And plus, most of us know one another.
Mm.
So you can just ask, could you reach out to somebody and ask them what they would do? Because I know Mary Kay at UT Houston. I know Fernando,
Mhm.
except for it's really hard to get him when he's in doing his overseas work in Asia, but he still answers his email.
Yeah.
And so most of us are really amenable to ask another for help when we don't know something. And I can tell you, we do that all the time. I get emails from people how to treat a pole gamma patient in Norway. And I get this email at 6 a.m. in the morning that I'm trying to answer.
And then one last question before we turn it over to our attendees. How long do you think patients should hold on to certain records? I know it's kind of a broad question, but
Well, it all depends if you're involved in electronic medical record.
Mm,
Because a lot of the really hardcore data, like your genetics data, lives there. But if you have a really odd genetic diagnosis or a really odd variant within that gene, it's best to keep that in a file that you have, because if the other provider who you may meet in the emergency room or heaven forbid anywhere else in a hospital, and they don't know what that means, you've got to show them that, yes, that really is my disease, and this is why. And the electronic medical record may not show that. It just may give the results, genetic history, you get a gene DX report, and it's pasted in there, and that's all you get.
Thank you. Appreciate it. So I would like to turn it over to anybody in the audience that might have questions for the panel, or if you would like to share things that have worked for you over the years as far as planning and organizing for your appointments. Yeah. Anne's coming. Eventually. Thank you.
We can pass this.
Are here.
So I wanted to start with like a advice piece and then go into a question, but the advice piece is another advantage of Google Docs is I've had times I've forgotten to print out my medication list, but then I can email it to the front desk of the office that I'm seeing. And I also manage a lot of my healthcare myself where my parents aren't as involved, but I have friends that'll step up and a health proxy in like 2 different states. So I can share constant access to them and they can see every time it gets updated. So they don't have like an old list if I haven't seen them in like a few months or something. But my question is, how do you go about managing it when you have a bunch of different conditions in addition to the mitochondrial stuff going on? And it's like sorting by provider gets a little wonky because it's like some of the stuff will go through where this provider will manage 2 different areas, but if you just do total symptoms or something with it, some of the stuff overlaps between conditions. So
So it's on. So I one of the things that I know from a hard copy standpoint that my wife and I use is I don't know, they're like contract files. And I mean they can be bought and they have different different panels and you still have one file but they're separated by different sections. And that because I have that situation that you just described, and I'm pretty sure that that's how my wife sort of segregates the different specialty providers based on symptoms in our situation. I don't necessarily do that electronically that well. I know maybe I do occasionally, but just by obviously, I have my medical folder and then just, create subfolders within that folder for the symptoms by provider. So I don't know if anybody else wants to comment on the panel.
So I think one nice thing with using Google Drive or something similar is that you can also do a shortcut to a file from one folder to another folder or one drive to another drive. So if you have information that's pertinent across providers or across symptoms, and I don't really have my folders organized by provider because we have changed providers over the year for some things. I have it organized more by specialty. But then, so if a piece of information that I have is relevant both to like neurology and physiatry, like my son has a baclofen pump, so that requires a neurosurgeon, but it also requires physiatry to refill the baclofen pump. You can do like a shortcut from one folder to another. So then you just keep it in one folder and then, but you can access it from the other one. Does that kind of answer the question? Absolutely.
So there are plenty of providers out there not on Epic. And so if you're seeing, let's say, a gastroenterologist and that person works at a place that doesn't have Epic, well, I feel like I'm the clearinghouse for all my patients for their mito disease. And I would like to see his note. And most of the time, they're willing to forward their clinical note about your visit to the PCP. And oftentimes it's electronic. So if you can just include your MitoDoc in that, we'll be sure to get it so we can try and be on the same page at the same moment that your GI specialist had switched something. Maybe he wanted to try septaheptidine as a serotonin drug for your bowel So your bowel works a little bit better. Well, I would like to know that because that does other things to like the brain and other things. So I, if I'm informed, at least I can start looking out for stuff like that. So it's always nice to have the PCP get your letter because that's really the gatekeeper a lot of times, but also your mito specialist because we kind of, we put our toe in a lot of different ponds, but we don't want to miss the important thing that that provider that you saw may be trying to communicate to us. Okay.
Thank you. Next.
What suggestions do you have? I really appreciate Dr. Saneto, you making the comment about Epic is great. It can be a wonderful thing, or it can be a blessing or a curse. And when you have patients, children, adults affected like those at this conference, you are seeing multiple specialists, and many times you have to go out of state. As you said, there's very few of you treating the mitochondrial disease and dysfunction. Our daughter was life flighted multiple times from our local children's hospital, great hospital. It just, and we're fortunate that they knew when it was over their heads, but they, sent her to Boston Children's or Cincinnati or to Denver and whatever. But now she's an adult. And when we're trying to, she was just in the hospital last week in the ICU, and it's over their heads and they're scared, and they wanted to transfer hospital to hospital somewhere. So they're trying to reach out to these hospitals, and they of course want the medical records and Epic and all. And what people are going to see is it looks like doctor hopping when in fact we actually were following doctors orders, and they're the ones that suggested and sent us these, different places. Or we might be traveling to a conference and she gets sick and we end up in a hospital, or skiing, trying to live life, and we end up in a hospital in Colorado. Again, that does not look good for what, especially, this time of year when you have all the residents and coming out of training and they've just been trained on, where I'm going. But how do you, when there's errors in your medical records, things like we'll have an intern or a resident put in there that our daughter had a colectomy. Well, she actually had a cholecystectomy. Big difference. They sound alike, right? Well, now she needs a colectomy, but her records are in there and they're sending this to a colon surgeon, and he gets them and he says, well, she's already had one. How much of her bowel's been removed? And we said, none. She's fully intact. And they're like, well, no, she's had a colectomy. And they think we're dumb and don't know. And it's like, no, she hasn't. She's got a loop ileostomy. She's fully intact. It's really, really hard. And the copy and paste job, and when you've got a complex patient, it just takes on a life of its own. What suggestions, because we just went through this last week and a doctor apologized and he corrected, he took something out the next day, but it's still, they can't change their record. So it's still in there, and it continues. The next doctor came on and they just copied and pasted the incorrect information.
I don't know if I have an easy, simple answer to that, but I followed this pharmacist in Iowa, and she's 57 now, and she has an insulin pump and she's deaf. And her sister has the same mitochondrial disease, but doesn't want to get tested. And she's got intractable diabetes, brittle diabetes. And so she knows to call me when the rubber hits the road and she needs something. We sort of act as a clearinghouse in a lot of ways. I had another patient on vacation in Mexico, and his son had a big problem. And so he called me, and I said, well, we're not the closest hospital. It's going to be super expensive for you to be life flighted anywhere. So luckily, Richard Haas is a really good friend of mine. And I said, Richard, there's going to be a life flight coming into your hospital. This is a kid. This is his disorder. This is what we've done in the past. Can you take care of him and keep me updated? That usually happens a few times a year. And it's nice to have one person who sort of knows your kid, even if your kid's now an adult, or you're an adult and you have a mitochondrial specialist like Greg Gaggins. And you go to a place and all of a sudden, you're seeing flashing lights or something, and your migraine headache's beyond control, and you've lost use of your left arm. Well, Greg's going to know what to think about, But if you're in an adult emergency room, You know, but if you have a piece of paper for an emergency visit with a phone number, please call, that's often helpful. And so we give emergency letters out to all of our patients. And the bottom line, and sometimes I really regret this, but the bottom line is my pager number. But I know the patient and I can find out what to do. It's good to have somebody in the medical hierarchy that's seeing you or your sibling to be able to contact.
Thank you. Actually, that, if I can say one thing, I'm glad you just mentioned that, because we do have an emergency. When she first started this journey, we had an emergency letter from one of our doctors, and the UMDF, had a form letter, and then we specialized it or personalized it. But now we do have a document, and her major diagnosis, we have it broken down to physician, the diagnosis, the physician's phone, the physician who diagnosed her's phone number, and the basic little treatment things. And that's been, we call it our emergency hospital, protocol letter. And we carry that with us. I've had all the doctors sign. I have her primary care sign it, her mitochondrial specialist, her infectious disease doctor, and I can't remember. We've got like 4 or 5 signatures.
That's great.
And it has been, it's funny. It's kind of like you said, a blessing or a curse. We were traveling, we were in Dallas. She was sick. We were trying to get back to Kansas City because bad time of year with big teaching institutions, and we thought we could make the 8-hour drive. We couldn't. We halfway over, we had to way home. We had to pull over in Wichita. That letter was a godsend, and I'm happy to share it with anybody if they wanted how we did it. But the doctor said, "This is incredible. I wish all my patients had this," and they followed it. It was a roadmap, and she was in, she was out. The best hospital care we've probably ever had in a tiny little town. We were scared to death to seek care, but had to. Other times I've presented it, and some of the other hospitals are like going, they don't even want to see it. They just want to throw it in the trash. They're like, I don't want to see it. They don't want to call. So it can.
And you also
can
have to
help.
remember, we're coming up on the newbies, July 1st. And there's an old saying that you survive July by the grace of God and the Washington Manual, or the grace of God and the Harriet Lane Manual, if you're a PEDS person. So it's really good to have phone numbers. And I really like your idea about the different major concerns that you have and the right person to get a hold of. Because it's not always going to be the mitochondrial doc or the neurologist. It may be the GI doc or infectious diseases. You just never know. And so it's good that you have a list that they can go down. Once an intern or resident realizes they're above their head, as soon as they look at you, they'll know. It's good for them to reach out and to have those numbers. That's a great idea.
We have time for one more question and then we can wrap up.
It's actually not a question, it's
Sure.
a comment. I have a medical alert necklace. They also make bracelets. And Lauren's Hope is where I got mine. And what you do is you just have mitochondria on the back, and you say C chart, and then the paramedics or the doctors at the emergency rooms, all they have to do is go to this particular phone number and they get everything they need. You don't have to carry everything all the time with you. It's online, what you want the doctors to know, not just what the doctors think they should know.
I was gonna say, I've seen those too, where it's like a QR code, so anybody can scan it versus, it being gate kept by somebody else. Something I was gonna add is, I guess this makes me old, but when my kids were young and we were, new and having symptoms and everything, one thing that I loved is that our pediatrician also had admitting privileges at the hospital, and we didn't have any hospitalists at this hospital, so if you were sick, and they'd send you to the hospital and be like, okay, well, I'll come see you at lunch, or, at the end of the day, or sometimes both. So, I feel like the hospitalist care has sometimes made things more complicated because there's so much back and forth. So I do miss the day when we didn't have to do that. But I think still having a pediatrician or potentially some other physician that's very involved in your care are my primary care doctor, who is also the primary care doctor for my two older kids, knows us in and out, will try to get us admitted to the hospital. Like, we'll contact the hospitalist team to avoid the ER if possible. Like, he is there. I remember texting him, you know, when I found out that I had COVID pneumonia, and I was like, I guess I'm not going home. So he's always so very involved in sort of the quarterback of our care. So if there's, and I meet with him pretty regularly every couple of months, if nothing else, but to update him on all the different things that have been going on, so that if it's like, oh, we have this concern, he will reach out first before the appointment and say, hey, this is going on. So I think I've also had primary care doctors that would do absolutely nothing and blow you off. So I do think, it's important to find somebody, because they do exist, that will be involved, is not afraid to, connect with the specialists, and all of that to help manage. Because you do need somebody that knows everything that's going on. So, and if your mito doctor isn't in town, it's often easier for that to be the pediatrician. So.
Thank you so much to our panel today. I really appreciate your time, and thank all of you for being here. And I think there's an 11:30 coming in, so appreciate all of you. Please reach out if you want to talk. We'd love to hear more, so thank you for your time.
Great idea. It was great. I'll have to pass that on to my patients.